Welcome to this INHWE presentation, which is investigating building response capability to health needs through interprofessional education and practice. And this is the second part of the presentation that you've already heard from Professor Adrian Shu. And this is looking and investigating what it was like to live through an epidemic, but an epidemic that happened nearly 60 years ago in 1964 in Aberdeen. And I was very lucky while I was doing my postdoc to study this epidemic for 3.5 years. The epidemic only lasted for a few months, but our investigation of it lasted an awful lot longer. But there are lessons, although this epidemic happened nearly 60 years ago, there are lessons from it that we can learn during this coronavirus crisis. There are similarities between the two epidemics and things that happened throughout the period that we can maybe think about and try and understand. But there's also the idea of collaborative practice, how people begin to work together through an epidemic that perhaps wasn't there beforehand, or how this all changes. And the previous presentation was taking you through the complexity theory and how this gives you some understanding of how epidemics, the course of them, and how collaborative practice can work. So if I just give you a little bit of background on the Aberdeen typhoid in 1964. Aberdeen is in the north of Scotland. It's quite a remote area. It's close to the sea. It has a population just of about, or in 1964, of about 185,000. The epidemic started in May 1964, and it was caused by a 12-pound can of corned beef that had been brought in from Argentina. The last case was admitted to hospital in September 1964, so the epidemic lasted from May until September. But the real high point, the peak of the epidemic, was towards the end of June 1964. Now, only 0.3% of the population caught typhoid. And actually, Aberdeen at the moment, only about 0.3% of the population have caught coronavirus. So we're quite similar for this area. It's obviously much higher in other parts of the world. People with deaths with typhoid on their certificate were very, very small. And the reason for that was that no one actually died from typhoid as such. They died from other comorbidities, and typhoid was a contributing factor. Aberdeen went into a lockdown phase for about 2 or 3 months where schools, etc., were all closed. And universities were closed as well. It caused untold havoc for exams and how people were going to finish that year at university, much the same as we're all coping with just now. And the biggest thing that happened in response to this was that daytime television started. Before this, television only came on at 5 o'clock at night in the UK. As soon as the typhoid outbreak started, television started at midday. So things changed, and from then on, there was daytime television in the UK. Now, the similarities between the typhoid outbreak and the coronavirus outbreak, in very sort of big terms, is that in 1964 there had already been previous outbreaks of typhoid in the UK. Quite unusual. During 1963 there were 3 other outbreaks at Harlow, at Bedford and at South Shields. But none of them were very large because they used older fashioned technology to cut the corned beef up. They used knives in a butcher shop. In Aberdeen we had a very modern supermarket that was using a machine to cut the corned beef up. And then it wasn't being cleaned in between cutting the bacon, then cutting the other cold meats. And you can see with coronavirus, there were other outbreaks, there were other indications of it, that there could possibly be this outbreak carrying on. There was also little planning had been put into effect to look at developing capacity for an outbreak, even though people thought these outbreaks might be coming along. Then the other thing that we noticed in 1964 that's also happening just now is the use of the media by medical staff, by the government, to get across their message. And in 1964 at 5 o'clock every night, there was a broadcast by the local medical officer explaining to everyone what they needed to do, what the main things that members of the public had to do to try and solve the outbreak. And it's the same as we get now at 12:30 in Scotland and at 5 o'clock in the rest of the UK, we get a broadcast by the government telling us what the latest figures are and what we need to do to keep the coronavirus under control. And the biggest thing in 1964 was people washing their hands. If people washed their hands appropriately, then things would be better. And in 1964, this was the big campaign, something that people were promoting. And now in 2020, 56 years later, the big campaign is hand washing. It's something that's so simple, but something that we have not sustained in the intervening years. Public areas were being cleaned, just as we see in the global pictures of different parts of the world with people out sanitising the streets. The same was happening in Aberdeen in 1964. Large venues were closed, the same as we're having nowadays, where there's nothing opened. The economic cost was very high. Now, it was only an economic cost to Aberdeen and perhaps some smaller areas round about, but it's still an incredibly crippling cost to the economy of this part of Scotland in 1964. Now, we've not seen what it's likely to be yet, but the economic cost is likely to be very high across the globe, and there are predictions of recession. Drugs were being repurposed. In 1964, there were indications that some of the new antibiotics, including amoxicillin, could be useful for typhoid. And so that drug was being used. And there's some indication now that drugs like hydrochloroquine might be useful, although again, the jury's still out on that one. And the process of exactly how it started, was it someone eating a bat in Wuhan in November? Is the same as what happened in Aberdeen. No one could believe that typhoid could survive in a can without any air. And it wasn't until 1968 that was actually proved. So there's, again, this not quite knowing how it all started. But the big story of 1964 was how the healthcare teams and the social care teams worked together. It was quite a different health and social care environment nearly 60 years ago, but the medical officer of health in the local area organised the teams of doctors and nurses to make sure that the epidemic ran smoothly and that there was less people in hospital. So there were so many similarities between 64 and now. Just to give you a little bit more detail, the corned beef went on sale at a local shop between the 7th and the 9th of May. And by the 12th, the first patient was admitted to hospital. By May the 20th, people knew that it was typhoid and the numbers were beginning to escalate. And 11 of the patients had all eaten cold meat from the same shop, and we'd already had one case of community transmission. And by May the 21st, the medical officer is able to announce that it is typhoid and that they have found the source. But they think at that point it's the shop, and it's probably some of the staff who had been on holiday in areas where typhoid was still endemic, and they were tested to see if there were carriers. That wasn't the case, and they soon discovered that it was probably typhoid that had come from a can of corned beef and then had spread to the other cold meats. And this is a picture from 1964 of the medical officer, the gentleman sitting on the one side of the table on his own, talking to the press. This was him giving them their briefing as to what should happen. Nowadays, things are much bigger. We see the pictures from Downing Street and in Scotland from St Andrew's House of the First Minister and the experts from the different departments giving their information. This is a headline from 1964, and you can see that some of these headlines could be easily replicated nowadays across the globe. You know, medical teams facing 3 critical days. How many times have we seen similar headlines like that? And that personal hygiene must get better. It is the duty of every citizen. Now, again, that is a message that's being promulgated across the globe. We must be better at our personal hygiene. We must wash our hands for 20 seconds. We must do this much more often. And so this is a headline from May 1964, but a headline that probably could be reused nowadays. Now, something else that's quite similar is the use of publicity leaflets. Now, the one on the left-hand side, How to Stamp Out Typhoid, was one that was developed by local retailers, and they helped with the distribution of it, and they helped with the actual publication of it. And you can see the best way to stamp out typhoid was soap and water. And the character in the middle who's going to war, as often we are, some of our press briefings sound as if we're at war with the coronavirus, but here in 64, we're at war with typhoid. And this is a character, a local, well-known local character called Wee Aliki. And Wee Aliki is going to sort out the typhoid. And on the other side, this is what everyone in the UK was sent last week from our Prime Minister Boris Johnson. And it's stay at home, protect the NHS and save lives. And inside we get given the messages in much greater detail, including wash your hands. So 2 leaflets, 56 years apart, giving us very similar messages. And the main thrust of it is wash your hands. Now, the numbers are nothing like as bad as coronavirus, because this is just a small localized epidemic. But it was 540 people admitted to hospital at a time when the hospitals weren't really able to cope with those numbers. 37 people were eventually rejected once they were tested as not being typhoid, although they had similar symptoms. 503 people were in hospital, not all of them in Aberdeen. Some people had already moved away and ended up in hospital in other parts of Scotland. 4 patients never ever were admitted, and 469 had typhoid confirmed. There were no deaths directly attributable to typhoid, and 1 baby was born to a typhoid patient. So very small numbers, but they still are an indication of what was happening in an area that's not all that large in Aberdeen. Now, what I wanted to do was look at the collaborative practice. And in 1964, you can see on the left-hand side of the table the numbers of people that were involved in the outbreak. And you can see that it's quite similar to 2020. But there's the difference of different healthcare systems now, different government systems within the UK with the devolved administrations, and also the change between media, which was very much print-based, and television, to also social media, which has created some good parts for the coronavirus outbreak, but also some negativity with some fake news going out across and very quickly across the networks. And also the use of care homes that were not quite so used in 1964. So care homes with the care of the elderly are much larger, much more used than they were 50 or 60 years ago, and therefore they are much more a part of this outbreak. But you can see the number of people that were involved with these outbreaks and the number of people that have to be collaborative practice ready. Now, in 1964, people were not being taught interprofessionally. It was really a word that was not known or thought of, and it's something that was just beginning to start. The first little green shoots of interprofessional education were starting in the 60s. But now in 2020, most students are taught how to work collaboratively across their sectors. But when you look at the sectors that are listed here, these are not just the healthcare sectors or the social care sectors, but government, the army, shops and retailers. And this is not how we usually teach collaborative practice in universities. It's very much, let's look at all the healthcare workers. But here we see that it's not just health that needs to be working collaboratively, but in a society. Society has to work collaboratively. And that's what we are being asked as citizens. It is our duty to try and help by washing our hands, by staying at home. And so collaborative practice, as Adrian was speaking about in the last presentation, is not something that's simple. It's not something that's just done by teaching at university. It's something that has to be fostered across a number of different organisations and across society as a whole. By the end of 1964 in Aberdeen, there was a parliamentary inquiry into the typhoid outbreak. And what happened was that they decided that sometimes the medical officer of health and his team did things really well, so should get some bouquets for that, but also he did some things really badly, and he should get some brickbats for that. Now, I would think by the end of the coronavirus, and we reflect back on it, that there will be some governments across the globe that will get bouquets, and some governments and some organisations that get brickbats. But we are all working together to try and develop the best response to coronavirus. Now, in 2010, the WHO put out its framework for action on interprofessional education and collaborative practice. And in it, they said that mechanisms that shape interprofessional education and collaborative practice are not the same in all health systems. Health policymakers should utilise the mechanisms that are most applicable and most appropriate to their own local or regional context. Now, this framework is being reviewed at present in 2020 and for a new document to come out. And I think that with the present crisis that we have across the globe, that mechanisms that shape interprofessional education and collaborative practice will have to change, because it's not just the healthcare professionals and the social care professionals, but society that needs to think about how we work collaboratively across with people like the retailers and the army to try and solve crises. Now, in 1965, I made out his annual report, and in it he said there are many lessons to be learned from the Aberdeen outbreak, but two only need to be mentioned here. The first is the importance of a high standard of personal hygiene in everyone, and we are already in danger of forgetting the simple facts less than a year later. And the second lesson is that infectious disease can still strike a modern community with dramatic and sudden intensity. And because of this, we must keep in being a highly trained and well-staffed health service to deal with such situations. And if only we had heeded the advice of this medical officer in 65, perhaps we might not be in the same situation that we are now. But it's easy to look back with hindsight and try and solve the problems of today. These are some references to some books and articles that you might find of use on the typhoid outbreak. But can I just end this presentation by saying collaborative practice is how we need to move forward in health and social care education, but to make sure that we take it as wide as we possibly can be. And we need to all now stay at home, stay safe, and stay well. Thank you.